Hello everybody, and welcome to PathoLogic. Today we're going to be discussing hypothyroidism in our veterinary species. Of our veterinary species, hypothyroidism is most common in dogs. It usually affects dogs between 4 to 10 years of age. The main cause is immune-mediated destruction of the thyroid gland, but some cases arise from idiopathic atrophy of the thyroid gland with replacement of the thyroid tissue by fat. Ultimately, both causes result in low thyroid hormone production. In cats, hypothyroidism is usually iatrogenic after treating for hyperthyroidism. Clinical signs of hypothyroidism are usually nonspecific. Features include lethargy, exercise intolerance, weight gain, and heat-seeking behavior. Animals also frequently develop alopecia, poor hair regrowth, and excessive shedding. They may also develop reproductive disturbances. The clinical signs of hypothyroidism are linked to the lack of thyroid hormone, which reduces their overall metabolic activity. For example, the lethargy and weight gain can be attributed to slow cellular metabolism. The low metabolism also means that animals have difficulty maintaining their body temperature, leading to heat-seeking behavior as the animals seek out sources of heat to help warm themselves up. There is also a lack of metabolic stimulus, resulting in lack of hair growth and the reproductive disturbances. Common findings on blood work with hypothyroidism include hypercholesterolemia, non-regenerative anemia, and hyponatremia. The hypercholesterolemia is due to decreases in normal lipid metabolism. The non-regenerative anemia results from decreased erythropoietin production and decreased stimulation of the hematopoietic cells due to the lack of thyroid hormone. We will also take a closer look now at the underlying cause of hyponatremia. In normal animals, antidiuretic hormone stimulates water reabsorption by the kidneys. One of the major triggers of ADH activation is decreased glomerular filtration rate. The reason for this is that the kidneys want to try and increase blood volume by reabsorbing water, which would in turn increase blood flow to the kidneys. In hypothyroidism, there is a lower cardiac output due to the lack of cardiac stimulation by thyroid hormone. This leads to decreased GFR and thus increased ADH activity. The increased ADH activity increases water reabsorption from the urine, which dilutes out the existing sodium in the bloodstream. We see this clinically as hyponatremia. Now we will look at some of the complications associated with hypothyroidism. Recurrent skin infections are common in hypothyroid patients. This is because thyroid hormone helps enhance the lymphoid immune response. Without thyroid hormone, there is reduced local immunity in the skin. Animals with hypothyroidism commonly develop pyoderma, generalized demodicosis, or yeast infections due to their low skin immunity. Polyneuropathy is another rare condition associated with hypothyroidism. This occurs due to demyelination and axonopathy secondary to the low thyroid hormone. We can see this clinically as facial nerve paralysis, megaesophagus, or laryngeal paralysis. Myxedema is thickening of the skin due to accumulation of glycosaminoglycans. This is a common occurrence in hypothyroidism and leads to a puffy appearance to the skin, often causing skin folds above the eyes and drooping eyelids. Finally, we have myxedema coma. This is a life-threatening complication of hypothyroidism that has been described in dogs. It is usually triggered by another concurrent disease. Findings include non-pitting edema, mentation changes, and hypothermia. The non-pitting edema occurs due to glycosaminoglycan deposition, as mentioned previously. The mentation changes are usually due to a combination of brain edema and hyponatremia. Myxedema coma can lead to hypothermia in several different ways. Lack of thyroid hormone reduces heat production in animals by decreasing their cellular ATP use, as well as decreasing catecholamine functions, which normally activate shivering. Brain edema can also cause swelling in the hypothalamus, which can alter the animal's thermoregulatory set point. Hypothermia is significant for hypothyroid patients because it can cause peripheral vasoconstriction and reduced platelet function, which can trigger coagulopathies in these myxedema coma patients. Now we will look at the diagnosis of hypothyroidism. First, we will briefly review thyroid hormone release to better understand the diagnostics. The hypothalamus releases thyrotropin-releasing hormone, which acts on the anterior pituitary. The anterior pituitary then releases thyroid-stimulating hormone. Thyroid-stimulating hormone acts on the thyroid gland to release the thyroid hormones T3 and T4. The primary screening tests used for thyroid hormone testing are total T4 and TSH. Total T4 reflects the amount of T4 in the bloodstream, including the T4 that is bound to protein. TSH levels look at the amount of thyroid-stimulating hormone produced by the hypothalamus. If an animal's T4 is low and their TSH is high, that may indicate that there is thyroid disease. TSH in this case would be high because it's trying to stimulate the thyroid gland in response to the low thyroid hormone. However, before we make any diagnosis, we need to rule out euthyroid 6 syndrome. Euthyroid 6 syndrome is a syndrome where thyroid hormones are low as a consequence of non-thyroidal illness. Potential associated diseases include hyperadrenocorticism, diabetes mellitus, liver disease, renal disease, etc. The condition is believed to be due to cytokines, inflammatory mediators, or high serum cortisol inhibiting deiodinase enzymes. These are the enzymes that convert T4 into its active form of T3. Essentially, this means that sick animals with a normal thyroid gland may have low or low normal T4 levels due to euthyroid 6 syndrome. Free T4 is the thyroid hormone in the bloodstream that is not bound to protein. Free T4 can be used as a secondary screening test for hypothyroidism, as it provides additional context about thyroid function. Patients with euthyroid 6 syndrome will have a low free and total T4 and a low TSH, while patients with hypothyroidism typically will have a normal or high TSH. Here's the diagnostic tree for the different tests available for hypothyroidism. Essentially, a total T4 and TSH are the baseline diagnostics, and a free T4 may be useful for providing additional information about thyroid function. To summarize, hypothyroidism is most common in middle-aged dogs. It primarily results from immune-mediated destruction of the thyroid gland. Clinical signs include lethargy, heat-seeking behavior, weight gain, and alopecia. Severe cases may develop myxedema coma, which is a life-threatening complication. You can diagnose this condition through thyroid hormone and TSH testing. Thank you for watching PathoLogic. If you enjoyed this video, remember to like, subscribe, and share with your classmates. Thanks again for watching, and we will see you in the next video.